So perfect. Thank you all so much again for joining. My name is Gideon Massa, and I'm the policy coordinator for NASW New York. Welcome to the first event of the joint town hall series with 1199 SEIU, NASW New York, and 1199 SEIU. How to get started. Advocate for fair salaries in social work. The chapter extends our gratitude to our attendees, all of you who are here tonight to learn and expand your knowledge and to gain clarity and resources for the work you do. We appreciate your time and your willingness to engage with us on this vital topic. Please note that this event does not offer at CE credits, but we do hope that the content will still provide valuable insights and foster meaningful discussion. We would be nowhere without our partners, and we extend our gratitude towards 1199 for engaging with us on this important issue. We truly appreciate them taking the time to share resources and action items with social workers. This is the time to take action on these important issues. To ensure a smooth experience, we kindly ask that everyone remain muted while the presenter or guests are speaking. If you have any questions or comments, please feel free to submit them via the chat, or if the presenter invites you to unmute, you may ask them your question. Please raise your hand in the case of a question. A staff member will be monitoring the chat throughout the event and will make sure any questions are addressed. We ask that all attendees respect the NASW anti-harassment policy, which will be shared with all of you shortly in the chat. Our goal tonight is to maintain an accountable and respectful environment for everyone and to provide information and resources to those who are seeking it. Additionally, we will be sending any materials and resources discussed today, as well as info on upcoming opportunities with the chapter, to your email by no later than tomorrow morning. Thank you all once again for being here tonight. We look forward to a productive and respectful conversation. And with that, I will pass it to the NASW New York Executive Director, Dr. Shakira Kennedy.
Thank you so much, Gideon. Welcome, everyone. This is a hot topic, salaries, and how to advocate for fair salaries. So NASW New York chapter, again, is very grateful to 1199 SEIU for this partnership and to be here to talk about what can social workers do. NASW New York chapter has partnered with a number of organizations pushing fair salaries, but tonight we're going to actually have a conversation around what can we do, how can social workers be seen. So without further ado, I'm going to pass the mic. Amanda?
Thank you, Dr. Kennedy, and thank you everyone for engaging with us on this topic as we're trying to build a stronger coalition to advocate for social work salaries in New York and New York State and New York City, as the chapter is recently unified from our New York State and New York City chapters to now being one NASW New York. And as we advocate in this work, we really extend our gratitude to 1199 as that just makes our coalition stronger and also allows the legislature and the governor to take us more seriously as we engage on this topic. So we're going to talk today. Can everyone see my screen? Today we're going to talk about how you can get involved with NASW New York as we work to advocate for social work salaries. First, like every event that we host at NASW New York with the policy team, we like to go into detail about how decisions are made at NASW New York and how we adopt legislative priorities. The salary priority in particular has been instated with the legislative agenda of NASW, New York State, and New York City for a number of years, for decades, as NASW New York has led the workforce initiatives, advocacy, in loan forgiveness and in salaries for decades now. Just to go through the process of how we adopt a legislative priority. First, the chapter is made aware of an issue or a campaign, and this is typically done through either a coalition reaching out to us, or this could be us going and engaging with the community and meeting an advocacy organization to advise us on what they're working on. Or it could be a member that comes to us with a concern and asks for the chapter to address this with the whole social work population. Or we could be advised about something from a public official and learn about their work to do with social workers. Or we could even get information from a news alert or news resource that was released to understand how to act on a specific issue that is affecting social work and the communities that social workers serve. So once we're made aware of an advocacy request, it's our job as staff to then deliberate that issue to the correct committee to get feedback from our members. We do say at the chapter that we are member led, and we really do try to adhere to that adhere to that statement as we have all of our members decide our legislative agenda. This is done through the Advocacy and Government Relations Committee, or AGR, where we are engaging social workers to basically look at bills, review bills, meet with legislators with us, and also give us feedback when it comes to specific niche areas of social work that we may need more expert guidance on. And so AGR votes on the legislative priorities. This is a meeting monthly that occurs with social workers, and they also decide the legislative priorities for our Capital Action Day, which is typically in February. Then we also have our political strength, our political arm of NASW, which we use to endorse candidates that support social work values and social work bills that will inevitably help the profession. The NASW-New York PACE committee and meets monthly. They also decide, what would be a strategic move to advance social work in general and encourage social workers to run for office to have more political strength and political power. And then looking at everything, the endorsements and also the legislative priorities must be approved by the board of directors. We have a board of directors that is also geographically spread across the state. So we actually have divisions. For the New York State section, we have 14 divisions across all different areas of upstate. We've also recently created 5 borough divisions in New York City as we've unified. So the job of this geographically spread board is to essentially ensure that we know what's happening in all areas of the state. Since we are such a vast membership, we don't only focus on New York City or only upstate. We have such a broad coverage that it's great to consult people that live in that area. And then, of course, all policy that we focus on is governed by the Code of Ethics that was created by NASW.
So,
Gideon?
so with that, we will begin discussing the 2022 salary report findings. Obviously, we have had this data for a bit, but I think highlighting it now is key to progress in general. So, I think firstly, and the key thing that stood out to me from our 2022 salary report, which again we've done a while back, but is still highly important, is social workers are severely underpaid relative to comparable professions. That being in the graph to your right, you can see it compared to nursing. Despite requiring a master's degree and rigorous licensure, LMSWs earn an average of $68,000, 821, and LCSWs $75,766 annually, while RNs with comparable education and scope of practice earn $77,600, and CNs earn $126,206. So obviously there is a harsh disparity, at least within New York State, when it comes to nursing and social work. Wages are largely stagnant in general as well. 34% of social workers reported no salary increase since being hired, and fewer than 10% received any regular merit increase. 81% said their salary does not reflect their job responsibilities. This is obviously something that we hope to change in the future, and this is why we have legislation hoping to change it, right? And this is not to throw any shade at nursing. We think that nurses are fairly paid, obviously. But that all being said, social workers are continuously overlooked, and we really hope that we can push that boundary and get social work on a similar level to nursing, at least within New York State. Um, and I'll pass it back to you, Amanda.
Yeah, and thanks, Gideon. One of the core issues within social work is that as the skill levels of social workers increase, the salaries stay stagnant. And to recruit and retain talented social workers, the salary must be comparable with the training, licensures, and job responsibilities of each position in social work. And so to look at the population that we did pull from the salary survey in 2022, this looks at the place of employment that social workers are spread out between. And this population was over 1,000 that we had for this particular survey. And so to truly understand where social workers are, when we look at this graph, it truly shows that social workers are just about in every area and sphere of influence in the communities that we see. They're in state office, so a lot of the time, social workers can work for a legislature or work for the government. Either that's OMH, OASIS, or in government positions when it comes to policy, as we see a lot of social workers get engaged politically. And then, of course, there's school social workers, which made up about 12% of the study. So that was about 111 out of 1,000, over 1,000 people. And then private practice makes up about 10% of the study that we saw. There are some social workers that are working in policy. A lot of social workers, about 18%, so that's about almost a quarter, actually clicked other. So that, just goes to show that there are so many diverse social work positions out there, and there are so many different ways for social workers to engage in the community and have vital places in it. Then 3% worked at nonprofits, 17% worked at a clinic. A majority of the survey actually worked within hospitals, as we're here to discuss with 1199 today. A lot of social workers are working in criminal justice spaces, whether that's prison social workers, and then 6% working in child welfare and 1% in administrative positions.
So the gender analysis that we did within our study is that probably unsurprisingly, but the gender analysis of social workers in the United States, social work is a female-dominated field. Approximately 81% of the workforce in the country identifies as female, and in the NASW New York State study, women are overrepresented at 89%, while 10% of respondents identified as male and 2% identified as transgender male, transgender female, gender queer, or non-binary. It is important to note that the census data for the nation was not available for transgender, non-binary, or genderqueer social workers in the United States. That all being said, clearly in a woman-dominated field, raising the pay gap that is already an issue within social work is key when it comes to equity for all, especially in the nation and especially within New York State. Yeah.
And then we look specifically at the cost of living adjustment, which is now being called the temporary inflationary increase, or the TII. And in this study, we actually found that there were vast disparities when it comes to receiving a COLA with social workers, which is something that the Human Services Council and the Just Pay campaign has been working to advocate for, and we've been in coalition with. But actually, over 76% of the survey actually reported that they did not receive a COLA. And then, kind of analyzing the different populations that did not receive a COLA, it does show that there are stark disparities when it comes to race on who is receiving this COLA. So, when you look at BIPOC communities, a stark amount did not receive the COLA compared to their white counterparts. And when you look at Latino and Hispanic population, only 2.5% of the sample actually received a cost of living increase out of 19% of the sample. And when you look at the white population, a lot more of individuals ended up receiving a COLA. So actually, 29% of the white sample did receive a COLA. So that was the highest amount of individuals that did receive the COLA. And so when you look at the BIPOC disparities in particular, among those earning 60 to 70K a year, 16% were white versus only 6% of BIPOC and 3.8 Hispanic. BIPOC workers were also less likely to receive the COLAs, as I mentioned as well, and also were found to be carrying higher than average amounts of student loan debt, which is something that can add to the burnout and also inevitably leave social workers to leave the field, as, maybe to compensate for that high educational debt, they would have to find another job and then experience burnout, causing them to potentially leave the field. And so racial disparities extend beyond base pay. White social workers were nearly twice as likely to receive cost of living adjustments as opposed to their BIPOC colleagues.
And as you can see here, only 24% of people in our study were able to collect the COLA, which is obviously something that we hope to raise in the future.
Yeah, and just to go a little bit further into the salaries by race, when we look at the study, there is 16% of white social workers that make 50 to 60,000, and when you get to the 80 to 90,000 range, 6.2% of white social workers make over 80 to 90,000, 1% of Hispanic, and 2.3% of the Black population. So when you start to get into those higher salary ranges, you see a very stark disparity in what populations are earning that compensation rate. And that even goes to show, relating to the merit increases, it was also found the same disparity in terms of more of the BIPOC population noting on the survey that they have not received a merit increase either in the last 5 years or at all since starting their position.
So with that, we would like to launch our 2026 salary survey. Obviously, a bit of our data has been outdated at this point, and we hope to recollect and learn how social workers are doing within New York State. So with that, I'll post that in chat, and we will be sharing this in all of our outreach that comes to the policy corner, etc. And we would love for you all to fill out the data so that we get a better understanding of social work within the state.
Yeah, and with this salary survey, we really hope to cast a wide net and get a very large population pool to really support this work, to make sure that we have a broad understanding of what disparities are existing right now, where they exist in terms of fields, and how to specifically address those disparities as opposed with geographic location as well. So I'll go a little bit into this part. So we really aim to accomplish a lot through this survey. Of course, we look to complete a new 2026 to 2027 salary report, and this will assist us to send to legislators as we're talking about this topic. Because of course, when you're talking about a problem, you want to have some data to back what we're speaking about. And as people complete this salary survey, it can help us look at the broad understanding of what communities in the social work population are experiencing adverse effects from the disparities that exist. And also, it will help us figure out how to address which populations to prioritize when it comes to addressing these specific disparities. And the 2022 survey, it was a critical step, and it was actually sparked because Senator Roxanne Prasad actually requested this salary survey as we went to talk to her about the problems that existed within the social work population. And she was like, all right, we'll make a survey, get a report out so I can see what's actually going on. And Senator Prasad is leading the charge on the TII, or the temporary inflationary increase, where they're actually trying to get 4%. Right now, the governor's proposed 1.7%, which is a little bit insulting, we'll admit. So of course we want to raise that COLA, TII, get it to as many social workers as possible. And Senator Prasad has been a great champion for that. Her legislative staff member will be here Thursday, so please be sure to register for the second event if you have not already. Another goal that we have with this salary survey is to expose and quantify the persistent disparities. So now that we've set a precedent with the last social salary report, what we want to show is that this is consistent findings. So that wasn't just a one-time thing that we found these disparities, but we want to show that this is continuous over a number of years, and this is something that needs to be addressed urgently as we're in this mental health crisis right now, and the demand for social work services is higher than ever before. Yet we cannot expect to recruit and retain social workers into a profession that is underpaying them and also undervaluing them. And of course, the last goal is to drive concrete policy change. This data will directly inform our advocacy priorities in Albany and will help support our coalitions that we are working with as well. And it will also support our loan forgiveness initiative, as, we can use these two narratives together that, of course, if you have high loan debt, if you're entering a profession and you have low pay, then it will be hard to pay off that debt. And so another initiative that we've been working on is to increase the funding for the New York State Social Work Loan Forgiveness Program. And so as we're talking about salaries, we can never leave out loan forgiveness as well, as they go hand in hand to assist in recruiting and retaining social workers into the profession.
Th- Thank you. And yeah, lastly, or some of the last points here is just we have just released our advocacy toolkit. This is the bread and butter on how to get involved in policy within the state, how to advocate really as well as you possibly can, especially for when it comes to social work items. We have tried in the past to go through the advocacy toolkit, but it is very long and in depth. But nonetheless, I still highly recommend going through it. It's very easy to walk through, although long, and it'll make your tools and your ability to advocate far, far better. So please take a look at the advocacy toolkit. It just dropped and it's on our website.
And then next, we just established a new NASW Power of Social Work podcast. We're doing this through national with the NASW Social Work Talks podcast. So this is another way to amplify our advocacy issues with the NASW New York chapter. We've been really excited to launch this, and we hope that you can take a couple of our first episodes a listen and just check us out.
And if you have not heard already, we have our policy corner that comes out every Monday that is giving you the what's what of social work in New York State. Highly recommend becoming a member and signing up for the policy corner. It's going to give you the rundown on what we are working on bill-wise, etc. Here's a good example of it. Yes, perfect. This is the one from this week.
You can see events going on, our coalition information. This is about the Just Pay rally we were talking about. They actually have a rally coming up on the 14th. And then we include things about federal updates. Here's the toolkit. And then lastly, we want to encourage you all to submit to Currents. This is our arm of the chapter that supports op-eds. And so, of course, when social workers submit their opinion from the ground, we really appreciate that, as your perspective is something that the legislature and the governor really appreciates, because of course we can reiterate what's happening in general and talk about, perspectives from people that we've spoken to. But when people hear from social workers directly about clients they interface with, their burnout, what they're dealing with, and, if, their salary has affected their daily life, if their loans are forcing them to give up their, rent, we need to hear what, you're being put through because of salaries, and because of your low salary. So, things like that will really help us to really communicate to the legislature that this is a problem and it needs to be changed.
And lastly, visit our Act Now page, please. It's the best way to reach your legislator. It's key to getting change done when your legislators and when you are a constituent and your legislators hear from you. They actually do take note. This is partially their job. This is what they need to be doing. If everyone's upset at them, they're going to be upset as well. So please visit our Act Now page, sign our Act Nows, send letters to your legislators, give them a call even. That would be great.
Yeah, and we will have a section in this event where we go through Act Nows and allow time for people to complete them right here. So stay tuned for that part. To close our presentation, I just wanted to say a couple quotes from social workers that responded to our 2022 survey. So we did themes. Theme number 4 was that in general, social workers are underpaid and do not receive regular raises. One person said, I've not had a raise in years, even though responsibilities have increased and revenue has increased. Director thinks there's only so much you can pay a social worker. The entire field is burnt out and lacking resources. We can barely afford to live in New York State. This profession needs to change or no one will go into it anymore. We want to live a comfortable life too, and I think we deserve that at the very least. You can't help others if you can't take care of yourself and your families first. And so, of course, we resonate with that, and that is why this is a priority that the chapter has held for a long-standing time. And so, thank you so much for being here tonight, because that is the first step. So with that, I'm going to turn it over now to I'm going to turn it over to David Greenberg from 1199, and he'll discuss how to get involved and how to unionize within their organization.
Hello, everyone. I really appreciate being here and being invited to be here. Um, and I'm going to just start this out by saying, when folks are organizing, and I'm going to go backwards, we ask people to tell their personal story. So, like, did you get your COLA increase? I have not gotten a raise in years. These are all accurate. But if I'm talking to a coworker, say, is it okay that we're making less each year? When the price of eggs, when the price of gas, when your rent, when your house goes up and you're making the same, you're actually making less. So I think that's just part of the respect issue that it's not that you're not getting a raise, you're actually getting a salary decrease. I mean, they're both true. So just to back up, my name is David Greenberg. I'm one of the vice presidents in the new organizing department of 1109 SCIU. And we are a healthcare union and social justice organization. For those of you who are attending who are not directly involved in healthcare, we do have a little bit of a thread where we represent members not directly related to healthcare, but also as part of SCIU, we can always refer folks to a union where it is their wheelhouse if it is not something that we're directly involved in helping people organize. So I'm just going to start off with saying that we represent over 300,000 workers in New York State and over 450,000 people nationwide. This includes well over 3,000 social workers in New York State alone who work in a variety of healthcare settings, including hospitals, nursing homes, mental health agencies, community health centers, substance abuse facilities, and many others. And the problems facing social workers thus become our problems, problems we are compelled to address. These problems have their roots in a society that has turned away from its commitment to the poor and disadvantaged. There is also less commitment to funding healthcare, and market forces hold ever greater sway in our healthcare system. This has resulted in a number of negative consequences. Many agencies and neighborhood health centers have suffered severe cuts in their funding. This in turn places tremendous burdens on the social work staff as they try to do more with less. In addition, it becomes very difficult for us to improve or at times even maintain contractual standards when there's no money to pay for it. This results in social workers being even more underpaid, leading to worsening short staffing and heavy caseloads. Hospitals are under pressure to discharge patients as quickly as possible, which also results in heavy demands on social work staff. In addition, many hospitals have followed the misguided advice of consultants in creating certain case management models that marginalize the role of the social worker in discharge planning and subsume everything under an RN. In some hospitals, we have seen the demise of social work departments with social workers reporting directly to nurses. This is a model that assumes the issues involved in a discharge of a patient are primarily clinical, with the issues social workers deal with seen as peripheral. The RNs are simply not trained to identify and deal with the many complex biopsychosocial issues that arise in dealing with an illness. The results are bad for the patients and the social work staff. What is the role of our union in all of this? 1109 is the voice of the social workers in their workplace. In the agencies and health centers, we have fought to convince the administration to include their social workers in a positive way and looking for solutions to the difficult situations the agencies find themselves in, not just threaten them if they don't meet caseload quotas. In hospitals and nursing homes, we have fought against models that minimize and deprofessionalize the role of the social worker. In all settings, we fight for the best working conditions, wages, and benefits that we can for the social workers. And politically, we work to increase the funding stream for all these settings. About 25 years ago, 1199 and NASW entered into a formal alliance with the initial goal to win licensure for social workers in New York State. Social work licensing was won in 2002, And it's fair to say that this doesn't happen without 1109's political muscle. In addition to 1109 being an experienced and powerful political player in New York State, when 1109 lobbies for a bill affecting a particular profession, we are bringing the strength not just of our members in that profession, but of our total membership in New York State and nationwide. For 1199, the alliance with NASW gave us the benefit of your expertise on all aspects of the social worker profession. This included working with NASW to co-sponsor continuing education seminars for our members. While the alliance stopped being operational, this experience shows our confluence of interests. More broadly, we share NASW's commitment to building a more just world by serving those with the least in society. And of course, we work to raise the wages and living conditions of social workers through traditional union collective bargaining. This was tweaked, but was mostly something that I took that was written 25 years ago. So is this still current? Has it even become greater in the last 25 years? Um, and so when we talk about traditional union collective bargaining, union elections are run through the National Labor Relations Board, which is a branch of the federal government. And depending on the setting where you work, there are guidelines regarding union elections. In a hospital setting, the federal government divides workers into different bargaining units. So there's people who do not need beyond a high school education for their job. They might have it, but if they don't, they deal with patients, they're considered part of the service unit or support staff unit. Then if you don't need beyond a high school degree and you don't interact with patients, generally you're part of the business office clerical unit. Then we have the technical unit. And so for the service unit, we're talking about housekeeping, food service, CNAs, and many other titles that fall along those guidelines. Then we have the technical unit, folks that generally need the equivalent of a 2-year degree, respiratory therapist, x-ray techs. Now as qualifications have gotten a little more strict, pharmacy techs, EEG technicians, um, along those lines. And then social workers are part of what's considered the professional unit, which the RNs always have their own bargaining unit. So the have their own RN professional unit, but then the professional unit is, and this is part of what makes it difficult to organize. The laws in place are not designed to make it easy for workers to come together. So the professions are very different. When you're talking about rehab, occupational therapist, physical therapist, speech pathologist, and audiologist in that area. In the lab, medical technologists. You have now in the imaging department, as technology grows, you have nuclear medical technologists and some other groups that are not only technical employees in those areas, the pharmacists, dietitians, and then somewhat related to your field, case managers, substance abuse counselors, folks who did not certainly need the level of education that you have, but do need a specific 4-year degree for their profession, mental health counselors. And now in the past 10, 20 years, nurse practitioners, physician assistants have become a big part of that. So the law, unless you have an agreement with the employer, in a hospital setting, social workers do not have the legal right to organize as a title. They need to organize with the rest of the professionals in that bargaining unit. In a health center, the laws are a little different, where there's a professional and a non-professional unit. So all what would be considered the technical unit in a hospital setting votes with the non-professionals. And the social workers vote with the medical providers and any other 4-year degree. It's not just if you have a 4-year degree. Many health centers say you need a 4-year degree, But if you don't need a specific 4-year degree, you're part of the non-professional unit. Social workers clearly need a specific degree, so you're always part of the professional unit. But we're talking generally social workers, nurse practitioners, PAs, and in a health center, say that 10 times fast. Um, we're talking about physicians as well. In a hospital setting, physicians will be part of a separate union almost all the time, but in a health center setting, they would be part of um, the unit with the social workers. And in that type of setting, there's it's called a sonotone election. So when there's election, first the professionals are given two questions, and the support staff and non-professionals are given one question. First, the professionals are asked, do you want to be included with the non-professionals? If the majority vote yes, all the votes are thrown in together. If the professionals vote no, then there's two separate votes. So you can actually win an election with two separate votes. A union is unity, so we're generally always encouraging folks to vote together. And just as a personal aside, I think it's disrespectful that professionals get the option to vote together or separate, and the non-professionals do not get that option. So this is all, I think, related to the question of salaries because the more difficult it is to organize, the more unions percentage of the workforce in our country gets smaller and smaller. There's a direct correlation to salaries that exist in this country. And I'll say, without me having done a study, my understanding is in states where the nurses' salaries are closer to social workers than in New York, it's only because nurses' salaries are bad. It's not because social work salaries are elevated in the other states. It's because everybody's salary, especially in right to work states or right to work for less, where everybody's salary is lesser. So part of what I was asked to address was why are social worker salaries lower, not as high as they can be? Why are they depressed? And so I'm going to give you my opinion. This is not um, a union position, but I'm pretty much sure everybody agrees with it, that our society does not value professions that help people. When you look at what are the other professions where you need the highest level of education and you're not making comparative salaries to people with similar education, I think of teachers, I think of librarians, I think of dietitians, I think of a misogynist society where when there's a significant percentage of women in that profession, it's not a coincidence that the salaries are generally lower than in male-dominated professions. Um, and I'm sure without having researched it, where there's significant amount of people of color in the profession, our society depresses the salaries as well. If you ask pretty much anyone, hey, do you prefer to have 0% of the say in your life, or do you prefer to have 50% of the say in your life? Would you prefer to work under a guaranteed contract that can't be changed without your permission? Or would you prefer for your employer to have the flexibility to get rid of what they want and change what they want whenever they feel like it? It's a no-brainer. And that's all a union is. A union is workers coming together who have the same employer. And I saw in the chat one of the social said we should just strike. That's the traditional way where you have the same employer. But we had in our union in SAIU, we had the fight for 15 for fast food workers. So more and more people are thinking, outside the box and say we don't have to follow the traditional formula where people in the fast food, whether they work for Wendy's or McDonald's or Burger King or whatever, went on strike, left their workplace, came together in solidarity. So I'm talking more about the traditional way of doing things, but it doesn't mean that we always have to stick to a formula. that in order to come together, you have to be part of the same employer. In fact, what I hear that you're doing t today in your meeting is you're coming together throughout your profession, regardless of who your employer is. So you're already there. I'm going to read you a part of the 1109 mission statement, which is to stand up for quality health care, good jobs, and social justice for all, dedicated to improving and expanding patient care while protecting and enhancing the lives of our members, their families, and their communities. So I think it's really what I know of the NASW, the social worker mission statement. There's so much integrated in our mission and your mission and what you do. And it just makes sense for us to support each other and work together whenever we can. Um, I'll be right with you. This is not like a purposeful pause. Uh, so when folks want to organize, there's many different ways that employers try to discourage their workforce from organizing. I was a mental health counselor in a small psychiatric hospital in Queens called Holliswood Hospital. It has since closed since I stopped working there. And part of what I did is I helped organize my coworkers into joining 1199. At the time, I was part of the non-professional unit in that place. The social workers were excited to be part of the union, and part of the anti-union campaign from our employer, there's a good cop, bad cop component to it. So part of it was first of all, we believe in unions. It's just not the right fit for us. We are a small psychiatric hospital. Um, Now, if you move that to a health center, it becomes even more extreme. 1199 is a group of outsiders who are not committed, whether it's Planned Parenthood, whether it's Callan Lord, whatever it is we're doing. Why would we bring in these outsiders to disrupt our community? Or in a hospital setting, why would you want to join a union with a bunch of housekeepers? Do you really want food service workers and housekeepers making decisions for you? You are part of the management team. We don't look at you as employees and us as managers. We're all in this together. And these are all, then that's not even talking about the fear tactics. And I think back in the day, it was more of the good cop. And now I think part of and you know better than me, so tell me afterwards if this is not correct, but I think just less respect for your profession where they feel more comfortable doing the bad cop stuff. We will target you if you come out and you're for the union. We will increase your caseload. We will tell you that you're going to go on strike. We will, all these different, we will tell you that the only thing the union cares about is union dues. These folks do not care about you. They just want to make sure that you pay union dues. Okay, this is my 1 minute warning. So I will tell you that the way to organize, it's difficult for social workers, I think, because unlike many departments, you're not all together on a daily basis. That's also your advantage. And you're also very well respected as a profession and often in the places where you work. There's three ingredients to forming a union in general. You need a small group of workers who are well respected, who fit the different demographics of the institution you're working with, whether it's shift, whether it's job title, whether it's if people congregate by ethnicity. You need majority support and you need to act like a union. And going back to what we're talking about, the COLA, it's telling your personal story. A union is strength in numbers. So in the beginning, it's important to talk to people you trust. We need to chart the universe because we're not here to be your cheerleaders. We're here to be scientific. And us as a union, our responsibility is to be transparent throughout the process and make sure that the folks we're helping organize are making the decisions. We're not here to tell you that we know what's best for you. We're here to tell you that you know what's best for yourselves. And the only way to go about it is to come together and make sure your voice is heard. It takes a lot of work. People are busy, people are drained. We are living in difficult times. So these are a lot of the reasons why it doesn't happen, but it is really, really impactful and amazing experience when people come together in their workplace to have a voice. It doesn't become the Brady Bunch, it doesn't become perfect, but there's no comparison to workers having a say in their lives and knowing that they have a guaranteed contract um, that can't be changed without their permission. In our union, I know it's over a minute. I'm almost done, I promise. In our union, the members make the decisions. So that's the main anti-union tactic. You do not want a third party coming in. Part of respect and dignity is in our union, the only people who can ratify a contract are the members of that institution. Thank you very much. Next time I'll drink more coffee so I talk faster.
Thank you so much, David, and we'll be sure to include any resources on how to get involved with 1199 SEIU in the post follow-up resources. I am going to pass it now to Doris Joy to say some words about her perspective as a social worker on the ground.
Thank you so much, Amanda. David, that was beautiful. Thank you for explaining my life to me in my right in front of my face. I've been a social worker for 25 years in healthcare, and everything he said was true. And grateful to this alliance because across the years, we've had to come together in some pretty dire times when our profession was changing, like David said, when we turned from certified to licensed. There was a whole lot of things that needed to be sorted through, and this alliance came through for us back then, showed us a way into licensure that has since helped a tremendous amount of people, and it has helped preserve quality in our practice as well. On the front lines in healthcare, as valuable as social workers are on a daily basis, that's demonstrated to us by the patients we serve, we still continue to be ignored in some places and not as valued as the work that we do really demands for the sake of our patients. So, this alliance came through for us during COVID, especially when the value of social workers in healthcare really became in my perspective and in so many of my coworkers' perspective that survived that time, to the front lines in healthcare. And we really proved the essential nature of our work for people that were dying during that time and the families that needed social workers to connect them to their patients that were in the hospital. And our creativity when it comes to planning for our patients in a system that does not value what we do on a day-to-day basis, that really came through, and it became sort of a marching call for us, a very renewed we had a renewed interest in improving our value and showing it, especially in a case management model that we're all facing right now in healthcare that pairs the social worker and nurse together, but finds it perfectly acceptable to pay the nurse much, much more than a social worker. We have the numbers that we'll be able to talk about in our Thursday meeting, but this is such a wonderful time to be able to come together again. And we are grateful to everybody that came to this call, I think, as well, because what we've learned in social work, not just in healthcare, but in society where we operate, is that all the things that we can fight for, of all the things that we can fight for together, our value has been a really difficult thing to prove. So we are trying to make this a bigger calling to invite as many people as possible to share ideas and come together, talk about the stories and really alliance with partners, even in a virtual age. We can join hearts and minds and come to pave a new road together. So thank you so much for coming. I'm going to pass it to Lauren, who's another social worker that works with me in healthcare. Thank you.
Good evening, everyone. Yes, to piggyback off of what Doris said, um, we are very much necessary in the healthcare field and very much undervalued. And we just want to thank NASW and David Green from 1199 SEIU um, for hearing us and being able to allow us this space and this town hall to be able to express how much we have value here and how much pay disparity is a viable topic that needs to be discussed. And hopefully we can come together in numbers and be able to fix the pay disparity. And welcome everyone again to come out on Thursday to hear the panel and everyone speak again about their experiences. Thank you.
Thank you. And with that, we're going to move into our Act Now portion of the event. We actually are advocating for the Human Services TII, or the Temporary Inflationary Increase. I'm dropping the link right now in the chat. Take a moment here to click on that link right there and contact your local legislators, your senator, and your assembly member, as well as the governor, to put a 4% human services investment. The governor has put out 1.7%, and we are here to say that that is not enough. And we need to see a comparable TII to ensure that social workers see some relief as they are experiencing high burnout and low salaries perpetually. And our next act now is to establish a human services wage board. So drop a fire emoji in the chat if you completed one of these act nows. We're here to show some strength and solidarity and flood the legislature with messages from social workers, letting them know that change is needed. The Human Services Wage Board would essentially be established to examine the disparities across the state in the entire human services field. This is sponsored by Senator Ramos and Assemblymember Bronson. And so please drop a fire emoji in the chat if you complete any of these action alerts. And here, the next action alert I have for the group is a private practice specific social work initiative, and this is to stop insurance clawbacks. So this is another way to ensure that social workers receive the wages that they are due. We often see social workers putting claims for Medicaid or for insurance claims based on services rendered, and it is denied for nefarious reasons or for small errors within that claim. So this action alert from NAMI New York State actually is a bill to stop insurance clawbacks. And the last initiative, which is a coalition that I recently engaged with when I went to Somos in Albany, they're called the Bump New York Coalition. So this is actually a bill that's advocating to raise the base pay of nonprofit human services workers to $29 per hour. So this is raising the true minimum wage when it comes to social workers, and they have a link to sign the pledge. So please drop a fire emoji in the chat if you completed any or all of these action alerts. This is a way to directly take action as you're here today with us. And another way, of course, is to join NASW and 1199 if you are able to advocate with us. We welcome everyone to join our organizations. We do have a few minutes left here today, so I want to open it up to the group for any questions on what we talked about today, because I know we covered a lot. So please drop your questions in the chat or raise your hand and we'll invite you to unmute if you have any questions. And Julie, I see you put support the New York Health Act. We are in coalition with the Physicians for a National Health Program, Metro, and they've been doing amazing work. So if you join AGR, that is an issue that we're supporting as well. Thank you, Margaret, for completing the action alert. Thank you, Sharon, for completing the action alert. And David just dropped his email in the chat just in case you want to reach out to him directly. I'll drop my email in the chat as well. And then before you all leave today, please make sure you're registered for Thursday's event as well. We will have Senator Prasad's legislative director, Lauren Walsh, who's actually an LCSW, coming to speak with us. And we will also have Assembly Member Lorinda Hooks to come speak on her experience in the Social Services Committee and for advocating for salaries. And we will also have Jennifer Zelzik, who is a Touro University professor. Sharon, I did just drop the link to register for the event. It's right above your comment there. So please register for Thursday as we want to show a powerful front, especially when we have the legislators present. So I dropped the link for that. And the last thing is I will drop the link to our join movement. This is actually the link to join NASW. If you join, there are multiple benefits, including being involved in our advocacy committees, as well as having a say in what we advocate for and how we phrase it. So we really encourage you to get involved in AGR or PACE, and I'll drop my email in the chat one more time. 1199 folks, is there anything that you want to say today before we close our session?
I just want to say I was actually going for my master's in social work when I came on staff for 1199. I have a great appreciation for everything that social workers do.
Thank you so much, David, and we're excited to be seeing you more and to advocate with 1199. And thank you, Michelle. Thank you, Janelle. Thank you, Jean and Samantha for completing your Act Nows. We'll also drop that in the post-event resources. So thank you, everyone, for coming tonight. And we will hang around a little bit later just in case anyone has any questions as we close out here. But thank you so much for engaging. We hope to see you Thursday and keep doing what you do best and help people. Thank you. Thank you, Michelle. Have a blessed night. Thank you, Sharon. Oh,
Thank
go
you
ahead and
all.
unmute Brittany.
Hi, good evening, I should say to everyone. I just had a quick question. So I work for a significantly big hospital system in New York City, and the hospital is pushing for the social workers to get their LCSWs. However, we are not being compensated for the increase in our licensure title. So I'm just wondering if you guys have any advice on how we can advocate for ourselves to get compensated for the additional licensure.
I would say in your advocacy for yourself, of course, first explaining to your employer the cost that it would pertain to you to even go through that venture. Of course, you have to get a number of CEU hours, and a lot of employers actually take the time to pay for their employees' CEUs. That is something that can really assist in, having your part of your benefits package when you're, trying to alleviate some of the costs with licensure. But I see Pilar, you want to jump in here on this one.
Yeah, I'm sorry. In normal circumstances, yeah, advocate for yourself, but don't do it alone. Advocate for yourself in a group. And this is why it's important to unionize. If you don't have a union, then now's the time because that is ridiculous and also not surprising at this point.
Yeah, so send us, the hospitals that's asking you to do that, and, send us some of the specifics with this particular request that they're asking of you, and we can send it to our partners just to see if we get any feedback on how to address how to move forward with that because that is not fair. It's definitely going to lead to some turnover within that hospital, I'm sure. Um, and it's definitely not fair for you as you incur those costs. So definitely, like I just dropped my email in the chat again. Please send me the specifics of what you're going through, and we can send that to some of our partners to understand how to approach that.
Great. Thank you so much.
I'm going to stop the recording.